In this segment, we're going to talk to Jeff about really a couple impairments that we're going to talk about, but then we want to get into big time on the breast cancer. But before we do that, I just want to read a little blog that Jeff and I did last week. This is all over our main portals right now. I think this is on Insurance Newsnet, Agent Navigator, Producers Web. I'm probably missing somebody, but it's out there, and of course on our own site. And I just want to read a little bit of the blog for you so that you understand why this is an important time, especially because there's so much awareness. Thank you, NFL. Listen to this. This is my blog out there. It says October is a big month. Oktoberfest, the Major League Baseball playoffs, Columbus Day, triple witching hour coming up in the third week of October, and Halloween. But after 25 years of campaigning, research, and education and empowerment, the National Breast Cancer Awareness Month dominates the month of October. And the partnership with the National Football League has delivered the biggest worldwide stage to the Pink Nation. NFL players, coaches, referees, club owners, and media covering the game all wear pink ribbons in tribute to the courageous women who have fought a pitched battle for life and death with breast cancer. Corporate America has joined in their support with an awareness campaign with breast cancer, and they mean business. And nowhere is this more evident in the life insurance business. For companies like from Allstate to Mass Mutual, breast cancer awareness has gone corporate. But it's more than just supporting the cause. Life insurance companies have changed their approach to underwriting women with breast cancer. And a significant leader in breast cancer underwriting is Allstate's subsidiary, Lincoln Benefit Life. Lincoln Benefit Life, like other carriers, play in the impaired risk space and have adopted new risk-selected methodologies that reflect established systems, and they can use new medical advancements as well as ongoing managed care and follow-up. The risk selection helps incorporate into their ratings for not only invasive but non-invasive cancer. And both of these changes, packaged the way we bundle it, especially here at Brokers Alliance, will actually give you a better light. It'll actually spotlight your case better. So I wanted to talk just a little bit about not only our blog today, but I want to talk about breast cancer and a few other places where I think LBL really plays well. Usually, 10 years ago, this was really a hard disease to underwrite.
Well, it has. There's been some changes in the industry, and at Lincoln Benefit Life, these are changes we just made in one big full swoop. This is something we've been looking at over the last 10 years, and we've been changing and tweaking along the way. And thanks to the great research done on the clinical side, which continues to happen, with our own studies in-house on our own mortality, we know for a fact that there's more survivors, people are living longer. And so we've changed to accommodate that, to make people that fit these certain scenarios in their fight for cancer have insurance available to them, and not just available, but something that they can afford. It's good to be insurable, but it's got to be something that you can sell, that people can afford and keep in place and be persistent. Persistency is another area in life underwriting that we worry about all the time. And we've made some changes along the years. I think they've been very, very good. And our mortality shows that we're there. We're right on.
So I mean, this is not a death sentence like it used to be about a decade ago. You could not get insurance. This was going to be declinable, major league postponed. But there are some stages that we have to talk about so that we can set the plate here. And of course, as you can see, I'm wearing my pink napkin here in tribute. Basically, I couldn't find anything for a guy on the show. So I want to talk about these stages because I want to be able to tell our audience, what do we think you can send in today that's not a postponed and a declinable?
Yeah, great question. In life insurance underwriting, we expect so much from our underwriters these days compared to just 15, 20 years ago. Particularly cancers. These are very sophisticated diseases to deal with for just on the physician side plus in underwriting, and it requires a certain amount of education and experience and finesse, if you will, on the underwriter's point. But the best case scenario of these, Steve, would be what's referred to as your carcinoma in situ, which is basically undisturbed, and it's stage 0 all the way up through a stage 4, which is your more worrisome, very aggressive and invasive cancers that have spread. Cancer cells have spread from the original area to other organs or other tissues.
Now, when we use summary statements, it's going to actually put these statistics in there from a data point of view. And so when I collect this, I'm hearing you say the area that you just described is not in the declinable or postponed range. This is a range that we're willing to take.
Well, at certain points through time, yeah. Now the best case scenario again would be the stage 0, because right after initial follow-up, which is usually about 3 months down the road, those cases are insurable. in the various stages, a little bit more worrisome. Sometimes all these cancers at some point in time are most likely incurable, but the postponement period might range from 3 months to a year to 2 years to even 7, 8, or 9, or 10 years. And there's so much involved in these. There's a long list of variables that come with it. The underwriter really isn't going to know until he has all this information in front of him, so they can go through it and evaluate it and see exactly what we've got to deal
Now,
with.
when we're looking at the path reports on this, I'm just wondering, for the benefit of our audience, when I'm looking at whether it's a lumpectomy or no, it wasn't as invasive as that. I'm trying to figure out, is that table B, is it D, is it, I mean, from our normal audience, we're not looking at percentages of mortality to standard. We don't calculate it out in our field underwriters. We're looking at just the basic idea. So when I'm looking at what you described, is that table B to what?
Most of these lower grades don't result in a table necessarily, but again, it depends on how invasive it was and the mode of treatment, and there's different modes. It could be a simple lumpectomy, which we're taking out just a smaller part of the tissue, the tumor, and some tissue around the tumor. We can get to full surgery, mastectomy, which is removal of the complete breast tissue, combination chemotherapy, radiation. So it all depends. The prognosis of each case depends on, again, exactly what the tumor was, the definition, the grade, and the staging, and the treatment involved. But at a stage 0, stage 1, these are your best case scenarios where, again, right after follow-up, we can usually insure them. But to specifically answer your question, we're probably looking at a rating which is going to include a flat extra per thousand for X number of years. So the tables, the rate's going to be there, but it's going to drop off and say maybe at the end of the 3-year period.
So really, we can kind of do a middle ground approach using temporary flats.
Yes.
Okay, I kind of like that because sometimes I just want to protect the issue of reoccurrence issues that are going to happen that could hurt the company from that point of view. But if we actually get outside that 36-month period or that 60-month period, that flat extra is going to fall off, and then we're back on a standard platform.
Back on a standard platform through time.
Okay, I'm thinking, when I see how we've evolved over the last decade, do you think that we're really applying temporary flats now as this kind of bridge to health during this period of, it's still a question, so they want to make sure they cover off their risk issue?
There's always a chance of reoccurrence at the higher stages. And even at the lower ones, there's always that risk in the back of the underwriter's mind. So everything in that underwriting file, the underwriter has to be aware of and fully understand. Everything from the family history to their own personal history, and again to what the pathologist actually said and what their treatment was.
Jeff, I want to talk about that for a second. Family history. Now, I noticed on some other diseases now, family history is kind of being relaxed. I mean, I've seen that.
Yeah, that's true. Yeah.
I mean, we used to say, I need to know, did your parents die? Some of that is gone, but not in this arena.
Well, generally overall, at age 65 and up, we're not so worried about the family history. And the reason for that, and there's a very good reason for it, is because we believe, our philosophy is that, they're really living their family history at that stage of the game. So up to age 65, it's something we look at. It's a risk factor, but at that point on, we really don't put so much weight into it.